Welcome back! In today's video, we're going to be talking about Lamotrigine or Lamictal. And this is in response to many of you who've asked us to make a video specifically about this medication. And so in this video, we're going to cover the top 7 things that you need to know about Lamotrigine, such as what is Lamotrigine, what Lamotrigine is used for, how long does it take for it to work, is Lamotrigine addicting, what are the side effects of Lamotrigine, we're going to then discuss those drug interactions, and then finally, my final thoughts on Lamotrigine. So, without further ado, let's get into it. Starting with number 1, what is Lamotrigine? Well, Lamotrigine is an anticonvulsant medication that is also categorized as a mood stabilizer, and it binds and inhibits voltage-gated sodium channels, and this stabilizes the presynaptic neural membranes. It also inhibits presynaptic glutamate and aspartate, and these are excitatory amino acids, and that's how it works in mood stabilization as far as decreasing those excitatory amino acids. It may also interact with voltage-gated calcium channels, which also helps to decrease neuronal excitability. And so number 2, what is Lamotrigine used for? Well, Lamotrigine was FDA approved in 1994. And it's used for the treatment of seizures, but also used in the treatment for bipolar 1 maintenance. So this is where it works as a mood stabilizer to help stabilize and maintain patients who have bipolar disorder from going from either manic, hypomanic, or depressive symptoms. It helps keep them pretty stable. And if you would like a quick review on bipolar disorder, make sure to check out my last video on that topic. Now, it's also used off-label for bipolar 2 maintenance and the treatment for acute bipolar 1 and bipolar 2 depression. And so number 3, how long does it take Lamotrigine to work? Well, the therapeutic dosages for treating bipolar with Lamotrigine is going to be 100 to 200 milligrams per day. There is some research and some studies where they use Lamotrigine at max doses of 400 milligrams a day for treating bipolar, but typically you're just increasing the risk for side effects. So therapeutic dose is 100 to 200 milligrams. But the thing about Lamotrigine is that you cannot start a patient on that therapeutic dose right away. There is a rare and dangerous side effect of a rash, which we'll discuss later on in this video. And so in order to avoid that, you have to titrate Lamotrigine very slowly. And this table here is what the FDA recommends and what many providers, including myself, follow as far as a titrate schedule to get you up to a therapeutic dose. And as you can see, it can take up to 6 weeks before you get to that therapeutic dose, and so therefore the effects of Lamotrigine aren't realized immediately. It will take some time before the medication becomes effective. And so what about number 4? Is Lamotrigine addicting? Well, no, Lamotrigine is not addicting. It has no action on the limbic system or the reward system of the brain. However, abrupt discontinuation of Lamotrigine has been shown to cause withdrawal seizures even in patients who don't have a history of seizures or are taking Lamotrigine for seizures. There have been some case reports of patients who are just taking Lamotrigine for bipolar disorder and then they abruptly stop taking it and end up having seizures. It's also reported that patients who are taking Lamotrigine for bipolar and abruptly stop taking it can go into a rebound manic episode. And so therefore, you must taper off Lamotrigine slowly under the direction of your provider. And so what are the side effects of Lamotrigine? Well, the common side effects that you'll see are going to be nausea, insomnia or somnolence, back pain, fatigue, rash, rhinitis or runny nose, abdominal pain, and or dry mouth. Now, Lamotrigine is considered weight neutral, and there are no percentage reports on sexual dysfunction, which is a good thing. Lamotrigine is typically well tolerated and considered relatively safe. However, there are some rare and dangerous side effects that you need to be aware of, starting with Stevens-Johnson syndrome. You see, the rash that is common with Lamotrigine will happen in about 10% of patients, and that's a benign rash, or a rash that doesn't go systemic, it comes and it goes away. However, 0.08% of patients may experience a severe systemic rash, meaning it goes throughout your entire body and can even affect multiple organ systems, and this rash is called Stevens-Johnson syndrome. This will typically happen if you titrate Lamotrigine too quickly. And that is why it's crucial that when you start taking Lamotrigine, that you titrate it slowly according to that slow titration schedule. It's also important that if you stop taking Lamotrigine for more than 4 days, that you're gonna have to restart from the beginning and start that titration process over, or else you're gonna be at risk for the Stevens-Johnson syndrome. Another rare and dangerous side effect are blood dyscrasias, such as neutropenia, pancytopenia, and thrombocytopenia. And what this is decreased blood cells in your body. And so you would have to be cautious and looking for symptoms of anemia, increased or easy bleeding, and unexpected infections. Another rare and dangerous side effect is aseptic meningitis. So you would want to seek medical attention if you start experiencing severe headaches with fever, chills, nausea, vomiting, nuchal rigidity, which is very stiff neck, rash, photosensitivity, sensitivity to light, myalgia, which is muscle pain, altered consciousness, or somnolence, or severe fatigue. Another rare and dangerous side effect is suicidal ideation, and this can also happen when you take antidepressants. And patients with bipolar disorder, as I mentioned in that video about bipolar, are susceptible to suicidal ideation and even acting on those suicidal thoughts. So if you're on Lamotrigine and you start having increased suicidal thoughts, or wanting to act on them, then this is an emergency and you need to get yourself into a psychiatric hospital or just a regular emergency room to receive treatment right away. You can also contact the mental health crisis line, which is now 988. Very simple number for if you live in the United States, you can dial 988, and I have international crisis numbers that you can call down in the description if you are in crisis. And the last rare and dangerous side effect that we're going to talk about with Lamotrigine is the fact that Lamotrigine binds to melanin-containing tissues, specifically in the eyes. And so if you're taking Lamotrigine long-term, you're going to want to make sure that you're getting yearly eye exams to make sure that Lamotrigine isn't affecting your vision. Okay, so number 6, what are those drug interactions of Lamotrigine? Well, there are some common drug interactions seen with Lamotrigine. Even though Lamotrigine is not metabolized by the popular CYP substrate that many medications are metabolized by, it still has some drug interactions. The most common one is valproate or Depakote, which is another type of anticonvulsant that is used as a mood stabilizer. Valproate or Depakote increases Lamotrigine concentrations by up to 2-fold. And so therefore, if you're on valproate and Lamotrigine, which some patients are, the Lamotrigine dose is going to be cut in half. On the other hand, other anticonvulsants or mood stabilizers, such as carbamazepine, phenytoin, and phenobarbital, will decrease Lamotrigine concentrations. And so therefore, Lamotrigine is typically increased or doubled when combined with those mood stabilizers. Other medications that can decrease Lamotrigine concentration are rifampin and primidone. Estrogen-containing oral contraceptives or birth control pills can also decrease concentrations of Lamotrigine by about 50%. And so therefore, if you're on a birth control pill and taking Lamotrigine, your Lamotrigine dose is most likely going to have to be increased. Now, if you're on a birth control pill that contains levonorgestrel Lamotrigine can actually decrease levonorgestrel levels by about 19%, and therefore making that birth control less effective. And so therefore, if you're on a birth control containing levonorgestrel, you're going to want to consider changing birth control or using another type of method of birth control to avoid an unplanned pregnancy. The last type of drug interaction with lamotrigine are the protease inhibitors, and these are drugs to treat HIV. Two of the most common drugs in this category that can decrease lamotrigine levels are the lopinavir-ritonavir combination, which can decrease lamotrigine levels by 50%, and the atazanavir-lopinavir combination, which can decrease lamotrigine levels by 32%. And so last but not least, number 7, my final thoughts. Well, lamotrigine is a very well-tolerated mood stabilizer, and despite those rare and dangerous side effects, it's actually pretty well tolerated. However, most providers will shy away from using lamotrigine for fear of a Stevens-Johnson's reaction. However, if you titrate lamotrigine slowly, as I just explained, that risk is significantly decreased. Another thing to note with lamotrigine is that it works as well as lithium, which is considered the gold standard mood stabilizer in bipolar disorder. It works just as good as that in the maintenance of bipolar disorder, and particularly in the maintenance of bipolar disorder with a predominant depressive symptomology, meaning patients who their predominant symptom is depression versus manic or hypomanic. They will only have a manic or hypomanic episode once or twice every couple years. For those types of patients, lamotrigine is shown to be just as effective as lithium. It is also my first choice for treating bipolar 2 disorder. The reason being because I find it to be very effective, and there aren't any FDA-approved medications to treat bipolar 2 disorder. All of the studies on the FDA-approved medications for bipolar disorder are conducted for bipolar 1 disorder without differentiating bipolar 1 and bipolar 2. And there are very limiting studies specifically on bipolar 2. However, in the CANMAT guidelines for bipolar disorder, they recommend lamotrigine as a first-line treatment for bipolar 2 maintenance. And when it comes to bipolar depression or acute depression, is actually a severe type of depression. So I find that lamotrigine may not treat that acute depression. However, it can treat the mild to moderate type of depression. So if you're coming to a provider with bipolar 1 or 2 and you're in a mild to moderate depressive state, lamotrigine can actually be very beneficial for you. So there you have it. Those are the top 7 things that you need to know about lamotrigine. Is there anything else that you would like to add to that list? Go ahead and drop that down in the comment section below. We learn from sharing each other's experiences. And also, please, don't forget to like and subscribe to the channel if you found this video useful. It really helps to get the message out to others. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you next week.